Sure. We at CHOP have been doing an introductory study over the last few years looking at the rates of depression and suicidality in our pediatric patients. This has been combined with neurocognitive screenings that we've also been doing. At this present point in time, we have 54 pieces of data that we've been looking at and kind of analyzing the amount of patients that we have that have been reported as being clinically depressed, and then also the surprising amount of individuals that also reported suicidality. How we are moving forward with this is really to try to continue to gather data, of course, but then to use this data as a framework and a reason as to really bring psychosocial members of the team to the table and ensure that our patients have access to the right mental health resources, as well as social work, neuropsychology, and psychology and psychiatry. It is very common, and I heard a very interesting talk the first day on the 31st that really talked about the percentage of depression being seen in nearly 40% of patients with MS, and whether or not there is a physiologic reason as to why that is probably out of my scope of knowledge. However, we do know that individuals with mental health concerns certainly need access to services, specifically if they have multiple sclerosis or any chronic disease. But individuals with multiple sclerosis do have a high rate of depression and anxiety. Certainly the need of mental health services for individuals with multiple sclerosis, certainly in my patient population in pediatrics, given that we have a smaller cohort and we are still experiencing the challenges that we are in locating therapists, psychiatrists, and other mental health professionals for our patients, I can only imagine what the adult MS community feels, given that they see that in much larger numbers. So certainly just the need of more structured mental health services embedded into a clinical care team, and then also additional community supports for those patients. We actually have been building for years a pretty comprehensive transition program at Children's Hospital and have partnered with our team at Penn Medicine. And we have a structured transition clinic, which includes our social worker, our nurse, and one of our physicians to help bridge that process. But it's interesting because a large majority of that process is ensuring that we have supports in place that we worry may get lost in the shuffle sometimes in the adult population, given that the numbers are just much larger and the team structure may be different. So questions like, what their mental health support looks like, what their community support looks like, what type of access do they have, what barriers are there to mental health services, whether it's financial, location, or insurance, and to try to work those out and work them through before the transition process happens so that patients are a little bit more empowered and have that in their tool belt. I think as long as there continues to be ongoing conversations, I have to say I'm beyond impressed with CMSC and so much of the information and the speakers that they brought, specifically for me as a social worker, to just have so many available talks for me that really geared toward mental health and psychosocial behaviors of these patients is truly incredible. So just that these conversations continue. Additionally, there was a lot of discussion about the effects of COVID-19 on our patients with MS and kind of what that also did for the mental health access of resources. So just to keep the conversation going and understand that we have a long ways to go before we can really properly support these patients.